We do want to start this half hour with a look at some of the significant health stories making headlines this morning. And ABC News medical correspondent Dr. Darien Sutton is here to break it all down for us. Dr. Darien, always great to have you.
Good morning.
So we're touting the benefits once again of the Mediterranean diet. Tell us about this.
It's benefits that have been reaffirmed. You know, these studies, they keep coming in and telling us that the Mediterranean diet is great for our health. So this study, it's about 25,000 people, and they found that those who stuck to the diet had a reduced risk of death from heart disease, among other causes, by almost 25%. So I think using some factors within this diet, for example, using olive oil as your main source of fat, decreasing added meat, decreasing added sugar, making sure you're focusing on a variety of vegetables is, of course, going to be helpful, and one of the reasons why the American Heart Association advertises this diet.
That's good news, because I just love drizzling that olive oil everywhere.
Same.
All right, so peanut allergies.
Yes.
Let's talk about peanut allergies,
Yes.
because now there's the possible benefits of early exposure. What do you mean?
Well, we've long known this. It's been, in fact, for a few years. I'm sure many new parents have been told exposing children early to things like peanuts is actually helpful into reducing their risk of peanut allergies later on in life. How much is that risk reduced? It's shown in this study. It's showing that those who introduce their peanuts and other variety of foods early in life have almost a 70% reduced risk of peanut allergies.
Wow.
And so that not only helps the child, of course, but you can imagine the amount of anxiety those live with who are trying to avert those allergies.
I am a big peanut butter fan. That baby is getting peanut butter, really,
Same.
because we do not want an allergy in our house. There's also a study out that found that girls are starting their menstrual cycle earlier than in previous decades. Is this exposure to hormones?
You know, I think that this is interesting. One of the reasons could be that when they're looking at the overall numbers, this is a huge study, more than 70,000 women from the age of 18 to 74. On average, it seems as though menstrual cycles and puberty are starting at least 6 months earlier than they were, for example, in the 1950s. One of the reasons could be hormone exposure, also toxins within the environment, also the rising rate of obesity can be associated with it. But this is not something to just think about as normalized, because this is associated to increased risk of diabetes and worse health later on in life. So getting to the bottom of this is really important, but the reasons why are really murky.
And then there are, it's not just that, but there are the other things that it leads to and how that impacts adolescents.
Emotional health, social health, really important.
You said it so much more eloquently. Thank you, Dr. Darien. And Dr. Sutton, before we let you go, I know that you have a story you want to share with us about Natasha Allen, the daughter of one of our producers fighting a rare cancer and using social media to help others with cancer build a community. Let's take a look at this.
Someone said, "I love your strong personality. I was diagnosed with the same condition 12 years ago." How does that make you feel?
Seeing that someone had the same cancer 12 years ago and they're still out here kicking, it gives me hope. The messages that really hit a chord with me are the ones where people say, you are an inspiration. Being able to be that someone for someone else makes it all worth it.
And Natasha Allen is partnering with Memorial Sloan Kettering Cancer Center to spread further awareness by creating a foundation in her name that will help others with synovial sarcoma. Much more on Nightline and Prime tomorrow and on GMA3 in the week ahead. You can also tune into her story right now on GMA.com. But Dr. Sutton, it obviously meant a lot for you to share Natasha's
so much so.
Story.
She's resilient, she's strong, and she represents young people who are being diagnosed with cancer. It seems as though it's just we're seeing it on our timelines and our social media, but the American Cancer Society has identified young people as the only age group that has seen an increase in the rate of overall cancer in the last 20 years. So I think it's so helpful and so important that we're getting that perspective from the patients, but also we're still working to understand why these numbers are increasing.
Do we have any idea?
You know, there's some suspicion, again, with the same discussion that we had regarding puberty. Is it environmental exposure? Is it diet? Is it obesity? But the one thing that I think is interesting when you speak to the oncologists is that these types of cancers are an early stage. We're diagnosing more late-stage cancers in young people. And so that is something that's not clearly understood, but hopefully we'll get more answers soon.
Yeah, and having that conversation and the awareness certainly can help a lot of people. Dr. Sutton, as always, thank you so much. We appreciate it.